Lateral sclerosis, also known as ALS, also known as Lou Gehrig's disease, is a rapidly progressive fatal neurological disease that attacks the nerve cells responsible for voluntary movement. We will be looking at ALS in regards to Mr. L. Mr. L is a 58-year-old male who is married and the host of a radio talk show. 2 months ago, he began experiencing muscle cramps in his left leg and an increased frequency of tripping. 5 months later, he finds it more physically demanding to climb the stairs and has an ataxic gait. He also has muscle atrophy in his left lower and upper extremity. He has been diagnosed with ALS. Here are some of the words you may not be familiar with. Amyotrophic is the absence of muscle nourishment, and lateral sclerosis is the side of the spine which is hardening or scarring. Syringomyella is a cyst on the spinal cord shown in an MRI, and cachexia is a wasting away of the body due to chronic severe illness. ALS is the most common neuromuscular disease worldwide. In the US, 5,600 cases are diagnosed per year, and in Canada, 2,500 to 3,000 people over 18 currently have ALS. ALS affects all ages, genders, races, and socioeconomic groups, and 90 to 95% of the cases occur randomly, and 5 to 10% of the cases are inherited, which is Mr. L's case. While looking at the ICF model, the body structures and functions that will be affected in Mr. L's case is the anterior horn of the spinal cord, the brainstem, and the cortical spinal tract, which affect the upper motor neurons and the lower motor neurons. The activities that will be affected is his daily ADL, climbing stairs, carrying groceries, dexterity, and speaking. His participation will lack with occupation as being a radio host, a husband, with social interactions, and while navigating his environment. There are currently no known causes for ALS, but they are investigating genetic, viral, autoimmune, and neurotoxic causes. Familial cases result from chromosome 9 and a gene that encodes for enzyme copper zinc, both of which become toxic and are sent to the anterior horn of the spinal cord. Over a dozen other genetic mutations are identified, and the most recent theory is that prime conditions for the toxin is at strenuous physical activity or over bursts of muscle strength. Mr. L's father died from ALS.
Pathophysiology. ALS is a progressive degenerative disorder affecting the upper motor neurons in the brain and the lower motor neurons in the brainstem and spinal cord. Motor neurons are broken down by neurotoxins that are secreted by glial cells, eventually leading to their death. Damage to the upper motor neurons cause spastic paralysis and hyperplexia, while damage to the lower motor neurons cause flaccid paralysis and decreased reflexes. Some areas are unaffected, such as the sensory and cognitive neurons, as well as cranial nerves 3, 4, and 5. As muscles continue to weaken, loss of function in the respiratory systems begin to show.
Since there is no one test for ALS, diagnosis is done through observation, past medical history, and neurological exams at regular intervals used to assess decline. Nerve conduction studies are used to assess the nerve's conducting abilities, and electromyography is used to show the electrical activity in muscles, which can show denervation and fasciculations. MRIs can disprove that it's ALS, as well as muscle biopsies. Since early symptoms of ALS present as many other disorders, the only way to truly diagnose ALS is to disprove all other conditions.
Clinical features. In the early stages of ALS, rapid loss of neurons appear in an asymmetric pattern. Muscles degenerate due to the death of the neurons. The lower extremity can experience tripping, stumbling, and awkward running. The upper extremity has difficulty with fine motor tasks, and the individual may experience bulbar symptoms, which affect speech, causing slurring, harshness, and decreased volume of voice. As it progresses, muscles atrophy leading to lower extremity spasticity, causing a complication of gait. Pain, cramps, clonus, hyperplexia, decreased range of motion, contractures are all present. Patient may sadly develop depression. In the late stages, immobility from weakness and spasticity, also complications with immobility, a loss of control of autonomic systems may spread throughout the body.
Unfortunately, ALS has no cure and nothing to slow the symptoms. Therefore, the only goal is to relieve symptoms and increase the quality of life. Riluzole is the only medication used for ALS, and it delays the onset of ventilation. There are other medications used for emotional issues such as depression and anxiety, as well as physical symptoms like fasciculation, spasticity, and pain. Later stages require suction and feeding tubes as well as full-time ventilation. It is very important to have a multidisciplinary approach to provide individualized care for the patients, as well as have all the special equipment and comfort for their needs. There's so much research going into finding a cure for ALS. The Ice Bucket Challenge alone raised $115 million for research from 2014. Below are our references, and I hope you enjoyed our presentation.